I'm going to keep this somewhat casual and talk a little bit about where we're going as a state. There's been a lot of work, and I often tell Barbara Drake this, that we're doing a lot of work, but we actually do seem like we're a couple steps behind Douglas County often at the state level, where we're going with behavioral health. And I see Captain Duffy here, who's been integral in our behavioral health task force work, and Barbara Drake as well. Both were involved in sort of what's not working, what's working, and where we need to go in behavioral health in our state. So I don't even know the date anymore, but Governor Polis essentially created the Behavioral Health Task Force to reform our behavioral health system. There are many things that work well with our behavioral health system, but there are many things that don't as well. So what do we need to do that's different? Well, for starters, we're ranked at the bottom of states in this country, which makes no sense to me, but we are ranked at the bottom of Mental Health America's rankings for behavioral health. And the way they rank it is how many people need behavioral health services and how many people are not getting behavioral health services. So part of that ranking is we actually do a pretty good job identifying people who need behavioral health services. We've not kept up with the amount of services needed to provide that. So 1 in 5 Coloradans need a behavioral health service. Think about that for a second. 1 in 5, how many people in this room? Right, 1 in 5. So I'm one of those 1 in 5. That's 1 million people in the state of Colorado. Our system is not built, it's not functioning to serve 1 million people. And what's happening is it's falling on the criminal justice system to serve many of those people. And you probably don't know, we're under a federal lawsuit as it is. We have a lot of people going to court because law enforcement will run into, and I don't need to tell law enforcement in here, or the CRT team in here, but you run into the same people over and over, right? And then you get a little frustrated, like the community's like, well, you got to do something. You can't just leave them here because you're just going to be back later tonight. So every one of those people get picked up by law enforcement, now have to go through the court process. A third of those, almost a third, are misdemeanors. Public urination. I mean, they're sort of charges for the purpose of trying to get someone services, right? The rest of us would have got a ticket and told to go home, right? Individuals who need services are actually going into the jails, and then they're court ordered to the hospital for incompetent to proceed with trial. Basically, it's just a way to get services for a lot of these folks. It's not really about their charges. It's about they need services, they need care. So we're clogging up the criminal justice system, we're clogging up the court system with individuals who just need help. And I say that because it's unfortunate that as a state, that's sort of where we've landed. And we never intended that, right? I think everybody through the decades has been very well intended when it comes to behavioral health in Colorado, but it's sort of where we landed. So how do we untangle that is sort of the next step. So I'm big on, and if I say anything, I'm from Jersey, so I tend to use a little foul language every now and then. Forgive me if that happens, but I'll say this. I'm big on, I got to clean our own house, and I was having a conversation with Bill from All Health yesterday, and we have the similar philosophy of we're not perfect. We're not perfect. It's important that we get we clean our own house up if we're going to ask for help and we're going to ask for to be trusted to do more. And I do have to commend All Health and under Bill's leadership over the last. We came on just about the same time, about 4 years. It's a different organization today. And now I'm not blaming the old organization either. Not. It's a lot of pressure, right? It's a lot of pressure to be that organization that's supposed to serve your community with the resources you have when the ask is so much larger than the resources you have. What happens, though, is that all in the criminal justice system. So the delta, the difference, right? Everything that our behavioral health system can't serve all falls in the criminal justice system, which is a horrible, horrible way to go. We had 342 people today waiting in jail to go into the state hospital. It's the worst it's ever been. We were at 39 people the day before COVID hit. And now we're at 342. 2 people successfully committed suicide in jail. That's not okay with me. I mean, that gets me angry. it gets me angry, right? Because not only I'm actually legally responsible and liable, my attorneys, the AG's office will be freaking right now for me to say that in public. But it's the truth. So how do we fix this, right? So we got to get our own house in order, and I think it's what's really important about getting our own house in order. Let's see if I do this right. Let me click on it. There we go. I'm going to skip over this and show this. I'm the most anti-bureaucratic government guy you've ever met. I really am. It's why I love working in state government. There's nothing better than being like, oh, I got a pragmatic, realistic solution for this. Why are we doing it this way? It's actually makes me look a lot smarter than I am in my job, right? Because I just go in and I'm like, well, why are we, what's pragmatic about this, right? This is what our system looks like today. It's not good for us as a state. It's not good for the community. It's not good for providers. When providers have to do all these lines, comes an administrative burden with every single line. Every single one of those lines. So what you're seeing here is the various state governments. You have courts up there, and then you have CDE out here, which are two entities that are not in the governor's purview, but are important. Probation is one of our largest behavioral health providers in the state. You have your crisis system, you have your substance use, you have your Medicaid, which is the RAY. You got community mental health centers who contract directly with state agencies, contract through the RAYs. You got county government and schools doing their own grants and efforts to meet constituent needs. You got federally qualified centers. You got specialty providers for substance use. And you got private providers over there. This doesn't work. And we hear from, I'm sort of preaching to the choir here. We hear from all our consumers the same thing. They feel this. They feel this. So we're failing them. You know, during the behavioral health task force, we had a realistic, we had a consumer story from a mom that exemplified this. She had a child, they're in Eagle County, had a child who had needs, wasn't getting met, got worse, eventually needed to be put in inpatient at Children's Hospital. Needed to be discharged. Denver, Eagle, not close to each other. Had to start all over with a new provider in their community. And then every time they had to step down, they had to start all over and all over. And then there was a disconnect with the school. That young person took their own life. They felt helpless starting over and over and over and over and over. They didn't feel like they were going to get anywhere. So how do we fix this? We believe the first step is the Behavioral Health Administration in the state of Colorado. That is the proposal that's on the table today. There will be a bill, and there will coming this session. There was a bill last session to create it. Now it's getting down to the details of what it looks like. So some things I'm going to share today. I'm not even sure I'm supposed to share publicly yet, but we're just going to talk a little bit about the BHA. I've talked to my team internally about the efforts we're going to. The Office of Behavioral Health right now that I oversee, we have community behavioral health, which works with our community providers in the community system in counties. We have 2 state hospitals. And then we have the Division of Forensics. That's we're responsible for not guilty by reason of insanity and those that are in courts, that are held up in courts with mental health needs, and where we're at with that. So what we think is we do a really, really bad job, each one of these agencies, trying to solve behavioral health by themselves. Not only do we really do a really bad job between each other, we do a really bad job working with our local communities on solutions. So we're all trying to find our own solutions. That's not good. That's not a good use of taxpayer dollars or efficiency of government. We're each trying to do the same thing. We're competing with each other internally for providers. In some cases, driving up rates and losing staff. It's still true. We're losing staff between each other because we're competing with each other versus saying, how do we solve this together? So what is the Behavioral Health Administration? It's not going to be the agency that does everything. It's going to be the agency that coordinates everything. The work across agencies, create shared goals, improving collaboration, driving accountability and transparency. This word comes up over and over and over again. I'm going to laugh because I had a meeting with my one of my attorneys yesterday about privilege and about accountability. And I'm like, well, let's talk about transparency. And the lawyer's like, no, don't share any information. It's privileged. I said, but if we're screwing up, don't we want to be transparent about it? And she said, no, we're going to get sued. And I'm like, well, if we're screwing up, should we get sued? They hate me. They really do. And it had to do with the hospital, and it had to do with our staff. You know, we have patients who make allegations all the time, and there's an investigation that goes into it that the staff don't get to see the report or the investigation findings, but then they could be held responsible from a personnel standpoint. I'm like, well, that doesn't seem really fair to our staff. That's a horrible culture. And she goes, but you don't want to share, you're going to get sued. I'm like, well, if we did something wrong, we get sued. So be it. So that got pushed up at the AG's office about, we can't let Robert do this. I'm like, why not? What are we hiding, right? Again, bureaucracy. I'm the most anti-bureaucratic person you want. The commissioner's shaking his head, yes, but if any of you did that and the county got sued, he'd feel very differently. Maybe. I know you do. I'm just joking. I'm joking. In doing so, the transparency thing's really, really important. We're not fooling anybody. It's not working. And when it's not working, it's clear it's not working. We're not fooling anybody, so why not just be really open about it? And why not share the accountability, right? It's no single person is sitting there saying behavioral health's not important. Why not share the accountability? The question is, how do we do that? How do we do that going forward? So transparency and accountable system in place is really, really important. I'm really big on data. I'm really big on data being on websites, not government-designed websites, privately designed websites, which function a lot better. When I was over child welfare, we did the same thing. We put all the county data, and the counties were not thrilled, but we put all the child welfare data on the website, and they're like, oh man, the reporters are gonna come, they're gonna get all worked up. What happened was the reporters no longer had a gotcha moment. So the media requests actually went down. They actually were like, well, how come you didn't? I'm like, well, we told you about this website. It's been there. The data's right there. So there's no gotcha, which to a lot of the reporters is like, oh, this is boring. I'm not going to go down this. We actually saw media go down. So I'm hoping behavioral health the same way, because if you've been reading the Colorado Sun, the Gazette, the Chieftain, 9 News, or whatever news channel you want to put on right now, we are everywhere with behavioral health. We're everywhere where we're failing. But nobody here is probably surprised. I'm not surprised. When COVID hit, I was just like, oh, this is just going to put a magnifying glass on what's not working. And that's what we're seeing. The BHA will provide an opportunity to streamline our overall system. So we need a state strategic plan. And there's something we're working on now is not just a state strategic plan, but we're investing our dollars to state to have CHI go around to local communities regionally. And if we can get a little more funding, we'll do it by county as well, to say, here's the complete continuum. For every 100,000 people, you should have X outpatient, Y inpatient, Z step down, this much invested into prevention. And we should go in every community with this sort of template. And then we could say, where you're green, yellow, or red on this continuum. Because while Douglas was one of the early ones to invest in behavioral health as a county, more counties are coming on board with mill levies and other ways to invest, using ARPA dollars to invest into behavioral health, the opioid settlement. My one fear is that we're all going in different directions, and we're not building a sustainable system, right? So the BHA is going to help with that, and we would like to create this template. We're not going to tell you how to do your community response. We'll say community response is an effective, needed part of the continuum. Do you have the right level of resources? If you're going to invest X dollars, here's a map of how things are going. So that's where we want to go with that, so that we're sort of investing together. And it's not all talk either. When the crisis system was first started, and it was created in a rush after the shooting in Aurora, the current crisis system was put in place after that. The contract went out to providers directly. And there's some things that worked really well with that. There's some things that didn't. It got really confusing at times. What was crisis related, what was other business related, other service related from other funding sources. And Douglas County, and I'm not saying this just because I'm here, was one of the key catalysts, and Summit County as well, in changing just contracting with providers. Because then you all were creating the CRT system, and you were creating your own mobile response, but yet the state was funding a different crisis response system, and it just didn't make sense to me. So one of the first things we did was, after talking with several counties, is we decided to create sort of an administrative service organization that would oversee a network of providers and communities, so we could invest where the counties were already investing, if they were investing. If they weren't investing, then we could create that and start new with that. We ended up using almost all the same providers, by the way. It's just a different structure. It's a different control as well. It is really, and I think partially is because I started an Office of Children, Youth, and Families before my current job, and worked very close with counties, got yelled at by counties and child welfare, but we had a really good relationship. And I really do think in Colorado, the only way it's going to work, the BHA, is if we built in the infrastructure, how we're going to approach this together. So, this is stuff about payments across systems. I'm not going to really go into that. So this is the stuff that's not fully public yet, but it's no surprise, right? So we have our staff, our commissioner that the governor is going to pick. That's going to be a cabinet member. So there's authority, there's influence, there's ability to pull the trigger. Right now, if you got a complaint about behavioral health, whether you're a consumer, county, whoever you are, you got to figure out what your payment source is before we can help you. You got to figure out whether it's healthcare policy and finance, if it's OBH, if it's child welfare, if it's CDPHE. You got to figure out your payment source, or I can't help you. Right? That's going to change, right? Because then it goes up to the executive director, and the executive director to the governor's office, and then they all talk about, well, which one of it is it? Who is it among us? In reality, it's all of us. So there's no ultimate person, and I like to tell legislators, by creating a commissioner, you got someone to yell at. You know who you're yelling at. You know whose phone number you got to keep to make that phone call and say WTF. But we can't let the departments off the hook either, right? Medicaid still got to be responsible. They got to own some of the solution. I'll tell you that wasn't always the case. It's been the case with the creation of the task force, now the executive director of Medicaid, who cares deeply about behavioral health, but you would have never known it before. But now that she's involved in this group that's supposed to come up with solutions, it's coming across. And then solutions are happening. We're getting the right rates for behavioral health care, right? In child welfare and other areas, we have kids with very complex needs. We've been placing them in residential settings that are not equipped to meet their needs. So no wonder they're failing out. No wonder they're running. Because the rates that we're being paid were not enough to have the right staff, the right clinicians. So they fixed those rates. That matters. That really does matter. And I'm not, money is the last question I always ask. But money's right next to the word sustainability, right? I mean, it's only sustainable if you can fund it. I mean, I don't think anybody here is working for free. So that has to be that sustainability part. The last part's really important. We tend to do work groups and advisory councils as an ad hoc thing a lot. We need consumer input. We need county input. Let's put a group together and ask them what their thoughts are. We got to build it as part of the infrastructure. We need a continuous quality improvement feedback loop by region, by county, what's working, what's not working. So we know if what we're investing in is working and not working. And we got to take our pride and throw it out the window. It's the hardest part. I gave a speech at the National Council of Addiction Disorders, and I'm glad that the governor's office wasn't there, because I talked about we don't like each other. Providers and state, we don't like each other. We do when we have coffee or whatever, and we get together and talk, but day to day, we're immediately at this distrust point and this defensive point, but we're both well-intended, and the problem is that the feedback loop is really broken, and that trust is broken. We need that continuous feedback so that we're making the right changes, but we gotta both let our pride go. And I bring this up because I have this with my team all the time, my staff. it can be hard because, I mean, you're busting your ass, you're working a lot, state employees don't make a ton of money. Every media thing is your fault. So then you start getting defensive and you start being like, I'm doing everything I can. It's not me, it's you, right? That's our human nature defensive sort of, I'm in a corner, I'm now in attack mode. So my pride is getting in the way. Not in a negative way, we all have pride, right? It's like, what else do you want me to do? I've been feeling like that the last couple weeks. What else am I supposed to do? I'm working 12-hour days, I'm doing what I can. And I always have to catch myself where I'm on the defensive to not go the other way and say, okay, you know what? I know I'm exhausted, but I'm still doing X, Y, and Z. I could do X, Y, and Z better, right? And letting it go. I have a really hard time with that when they're my ideas. You know, I have something that's the idea and I'm really pushing it hard. And one of those was care coordination. So about a year and a half ago, I really pushed hard on a statewide, overseeing care coordination infrastructure system. And you know, we got a lot of feedback from people. I got 5 minutes. All right, cool. We got a lot of feedback from people that it's not working, and we already do this in the community and things like that. And I had to let it go. It was hard for me. I had to let it go because I designed the whole thing. I'm sitting up at night, like even came up with a logo, all this stuff, right? I was really passionate about it, but I had to let it go. And now what we're doing today is we're going to invest in the technological infrastructure for care coordination and only provide care coordination where the person doesn't have it available to them, right? That's the goal now. That's where we shifted. Creating a gateway of information for consumers by community. I mean, Google does this with restaurants. That's my end goal, right? Is have a Google Maps, but a behavioral health maps, right? Same thing. Outpatient therapy, click it in, zip code, who's available, and consumer input. You ever use Yelp for restaurants? Almost all their information comes from people that goes to the restaurant. We should be secure enough and comfortable enough to say, why can't consumers put information so other consumers know their point of view? It's a gamble, because I'll tell you, if I'm feeling depressed, I think everybody sucks. And I go on Yelp, and I put, you suck. Right? So probably a giant disclaimer on there or something, right? But it's important. You know what's the most important thing of that is this provider's in my network. I called, they're not taking clients, FYI. They're not taking new clients. This is like the million-dollar question we can never solve is, and everybody's like, it's too hard. And then somebody told me this, one of the other executive directors, I'm not gonna mention it, said, don't take that problem on. You think nobody's ever been able to solve it. Don't take it on about the whole list of providers that take certain payment sources and they say they're taking new clients and you call and they're not. Don't take it on. The private sector couldn't solve it. You can't solve it. I said, well, consumers can, right? So this is the kind of philosophy that we're really shifting to talk about a data source that exists that we can use, right? And you can control some of the narrative. I'm not saying Yelp like open-ended comments because that will not go well. But you can put, click this button saying provider says they're taking new clients, but they're not, and then give the provider a chance to respond, right? So since I'm running out of time and I could talk forever about this stuff, I don't think I have other slides that I want to touch on because I want to make sure I answer questions. Yeah. The BHA will start July 1st, 2022. It's not going to be complete July 1st, 2022. It's sort of phase one of multi-phase approach. So that's where we're at. We're really, how do we get to a continuous quality improvement process where the counties are feeding up information, we're investing in similar things, where both sides are happy with what they're investing in, and how are we all accountable at different layers? So I brought up the crisis system earlier because, and I think I got on a little tangent and went off, but I'll go back to that. When we created the ASOs, there were some people that were not happy, you know. And the reality was, though, we were taking the information from the county and say, I don't want to invest, and Douglas County was a perfect example. I did not want to invest in a crisis mobile if there was already a mobile team available. How do we invest in things that are already working? And I think that's where the BHA has to go. We may disagree. We're going to disagree on what those investments are. But at least we have to sit down and have that conversation. I find that when we do disagree, we're not that far off. I had a county that we just had this with the commissioners had to get involved because the sheriff and I get a little heated about mobile response. and they wanted to do it, and they wanted law enforcement to go to every single mobile response, and that's fine for co-responder, but for crisis, they wanted to be the crisis provider as well. And if you're going to be the crisis provider, you have to give the community the option between law enforcement and non-law enforcement. It's also not a good resource of law enforcement. So we really disagreed because he had in his head a certain program, a certain idea he did not want to let go of, and I did not want to let go of. The community needs to have the options of non-law enforcement response. If you're going to be co-responder plus the crisis response system, you have to do those things. It found out we weren't that far apart, and we just needed a conversation. So because all of our things were through email, so we just needed a conversation. We both ended up getting what we needed at the end, and ultimately that's typically what it is. It's finding that time and space to do that, and that's what the BHA is really. So one of the benefits of the BHA is they're no longer going to see the state hospitals because those are fires that sucks all my time every day. So really splitting the work up so the BHA commissioner has room and time to have those conversations and investments. So.